Hey, again, good morning, everybody. It's Brad Petrella, Jeff Beglin are here with you. I'm not going to bother showing you the slides that you've seen many times from Jeff and I every week when we do a training. We don't want to mess up anything that our friends from Anthem, Kathy and Nancy, have slated. So we're just going to kick it off with them. But just remember, you can type in your questions. Jeff and I will try to find opportunities if it's really appropriate to ask Nancy or Kathy right then. Otherwise, we'll kind of get to them at the end because I know that we've already seen the presentation. It's not short, it should fill up the hour. So we just want to let them kind of get through it and then we can answer the questions and we can always go back to a slide. So, Kathy and Nancy, take it away. The floor is yours.
Great. Thanks, everybody. Good morning. So welcome to the 2025 Individual Broker Roadshow. Our theme for this year, which we think is very light and fun, is Rhythm and Blue. So like we did in previous years that we think worked well, we're going to kind of focus on three big items as we move through our presentation. Again, we feel that healthcare is local, relationships must be genuine, and we think optionality truly sets us apart, not only in our individual products, but also our group offerings. And of course, our Sydney Health app makes all the difference in our members' experience with our plans. So this is the agenda we're going to be going over today. Again, who is Anthem? We're going to recap our broker tools, talk about open enrollment and how renewals are going to be handled. Kathy will go over our plan updates for 2025, specialty, and we'll talk about commissions. As Brad and Jeff were so nice to do earlier, I'm Nancy Kuzenko. I'm one of the individual and small group sales reps. I happen to have the Northern Territory. I'm joined today by my awesome counterpart in the South, Kathy Shiplett, who is also an individual and small group account executive. So we're going to talk about presence and purpose to begin with. So, of course, I think everyone is familiar with Anthem and Blue Cross and Blue Shield. 1 in 3 Americans is currently covered by a Blues plan, covering more than 1 million members, of which 46 million are actually Anthem enrolled members. We have large doctor and hospital networks, as well as behavioral health networks. And in Ohio specifically, we have over 4,000 associates that live, work, and play in the same communities that you do, as well as your members. So let's talk briefly about broker tools that help make your job easier. Broker Toolbox, our Broker Plus mobile app, and Broker Hub. So this is a snapshot of the digital tools that we make available. Our broker launchpad helps get you to the right spot within the toolbox for the job that you're trying to accomplish. Producer Toolbox, again, is everything about quoting your enrolled members, your renewals. You can check your appointment status. The Broker Plus mobile app is everything that's available on the Producer Toolbox, just in a mobile version. We know everyone this time of year is not necessarily sitting in your office or sitting in front of your desktop or laptop, so we make all the same data available to you just in a mobile feature. And of course, our broker hub is our one-stop shop for all marketing materials, regardless of what Anthem state you're looking for them in, and regardless of what business segment, individual, small group, large group. So our producer toolbox, this gives you a snapshot of what that cover page looks like. We have made improvements and we'll continue to do that based on the great feedback that we get from our broker partners like Cornerstone and like yourselves. We have added a new global search under our documents and forms area. We also, based on your feedback, have added more robust, up-to-date billing information. And of course, you're able to pull up ID cards directly for your clients based on the product that they're enrolled in. Reporting capabilities. We think this is really key for you. Again, we allow you to run custom reports based on your book of business, based on group billing. You can run renewal reports to see what renewals are occurring within a given month. More importantly, you're able to run custom reports for members that are turning age 26, who are going to be terming off of group or individual policies, and also members that are going to be turning 65 throughout the year. You can sort by clients, employee lists, and of course, applications in process or process. And the delegate list really allows you the custom availability of determining who on your team has access to your toolbox. The Broker Plus app, as I mentioned already, again, is our mobile app. So it gives you the same data, the same information with the availability of a chat when you're on the go, especially this time of year. Of course, you can pull things like ID cards, customer information. You can stay informed with our broker news. You can even get it via guest access. And we do have an improved tablet design. So if you're working with your iPod or Android tablet, again, you can view in either a portrait or a landscape view. And you can download our Broker Plus app using the QR code on this screen, or download it through the Apple Store or Google Play app as well. Broker Hub. Absolutely your one-stop shop for everything you need for anything to do with marketing. You select your state. So maybe it's Kentucky. Maybe you do business with us in Indiana as well as Ohio. Maybe you have members in Wisconsin or Missouri, any of our states. You can sort by state and then business segment. You're looking for individual. You happen to be looking for a particular form, maybe for small group or large group. It really allows you to customize a search to get to what you quickly need to know that's available for anything on the marketing end of things. So open enrollment specifically in the Broker Hub, we have added a brand new dedicated link specific to open enrollment. It absolutely promotes things that you'll want to use state specific with one click. So again, another quick link tool to get you to exactly what you're going to be looking for as you move through open enrollment this year. So the open enrollment broker toolkit, once you get into it, very customized things depending on how you like to market yourself to your current members as well as potential members. So we have a variety of different marketing flyers with different visuals on them, a little bit of different messaging. We've got LinkedIn social posts if you like to do that, as well as paid social posts. Again, with a variety of different views and visuals to choose from. So let's talk about open enrollment. Hard to believe it's here already. So open enrollment for individual Affordable Care Act plans begins on November 1st and runs through January 15th. Any enrollments received by the carrier by December 15th will receive a January 1 effective date. Any enrollments received by the carrier by January 15th will get a February 1 effective date. Any enrollments outside of open enrollment require an SEP in order for those enrollments to be processed. And of course, all of our plans include robust prescription coverage to make sure that members are staying compliant with their medication needs. All of our plans include pediatric, dental, and vision coverage as required by ACA, and several of our plans also include adult dental and vision options. And of course, all of our plans include member access to our Sydney Health app, which is available 365 days a year, 24 hours a day, 7 days a week. And of course, more importantly, as we move through things that are occurring not only in our own state and our own country, but across the world, we see continued need for mental health services. So very robust benefits for our members in that area as well. Just like last year, again, the FFM is going to be doing bronze to silver auto enroll. To recap, what that means is if a member is currently enrolled in a bronze level plan, but is eligible based on income for cost sharing reductions in the silver level, and there is a silver level plan in the same product, so PPO to PPO, HSA to HSA, with the same carrier network, if those all align, then the FFM will automatically move that member to a subsidy silver level plan at renewal. Because of the timing for our renewals, the member may still get or will still get a renewal on their current bronze level plan. We will not know until later in December which members FFM automatically auto enrolls into silver. So the verbiage outlined in the red box is the notice that will be in our renewal information to the member, making sure that they are aware that FFM may automatically move them to a silver plan if they are eligible for cost sharing reduction.
Nancy, it's Brad. I have a question.
Yeah.
So, if the FFM does that, or better yet, broker does an early appointment, finds out that their income has changed or lowered, and they now are eligible just based on their calculations or their quoting that they qualify. Will the FFM still go in and make a change, or will it recognize that a change
It
had
will
already happened?
recognize the change.
Okay,
So I
good to
would
know.
say, again, getting that change in early and automatically, proactively moving them to a silver cost sharing reduction plan will, I don't want to say prevent, but it will get the member on the silver plan that they want versus FFM auto enrolling them in, again, the plan that FFM is going to choose. So
Yeah.
it's going to be
So,
later in December after the 15th before we get those
aha.
auto enrolls.
Got
So
it.
if they
So
get
it would
those
be like the
enrollments
last
in
fail safe.
prior to that, we would definitely recommend that.
Okay. So maybe for all of the brokers who have sent out their pre-enrollment email communications or letters that says, if your income to their clients, if their income has changed, please let us know. So if you see that, um, kind of try and get to those sooner than later so that you're in control. And um, it's always better to be in control for all the reasons that you and I know, and Nancy and Kathy and Jeff know. Um, Control your own destiny, not let an entity's computer system do it, because
Right.
it may not be exactly as good as the research that all of you do. The
Exactly.
network and art, pharmacy, stuff like that. So yeah, just stay in control or get ahead of it. I know we're only a week away, a little bit more than a week away. So carry on. Didn't mean
All
to
right.
interrupt, but I thought it was
Um,
important just to clarify.
Absolutely. So the other item that you'll see outlined in the red box here will be another item that's identified for members in their renewal communication. So we're letting them know that because of changes that were required by the marketplace, what was our lowest cost silver plan last year or 2024 may not be our lowest cost silver plan for 2025. So again, this is just notice to the member to make sure that they're aware that there may be other options that they want to look at for 2025. Maybe it's a newer option or an option that's going to give the member the lowest out of pocket cost, deductibles, and copays. So marketing materials. Our Digimag enrollment kits have been available on the Broker Hub since October 1st. So if you've not gone out there, please do that. We've got our on and off exchange medical product guides. We've got our benefit booklets. We have all of our specialty product brochures. As a reminder, we can sell dental and vision standalone. We've got our state network flyer that identifies the maps of who participates in our Pathway X and Pathway HMO networks, as well as HSA flyers that help explain to members how an HSA works. So renewals. Our renewals on ACA plans have been released to members. They will be posting to the broker portal. So you will see those posted in your portal by the end of the month. So you're aware of what plan we're telling the member they're being renewed to, barring any of those auto enrolls from bronze to silver later in December. As a reminder, any members that are on catastrophic plans, if there is a spouse who has turned 30 throughout 2024 or will be 30 before the end of the year that is on exchange, will be notifying that spouse that they are no longer eligible to remain on the catastrophic plan, and they will get an offer to move to their own plan. If that member is off exchange, they're just going to get a cancellation notice, but the subscriber themselves who is under 30 and any other members covered under the policy that are under 30 would actually get a renewal. So any of those off exchange spouses that are terming off, those are opportunities for you, certainly to write a separate policy for that member. Again, your dental and vision renewals, whether they're off exchange or on exchange, are going to include the dental and renewal details, and any members Again, their health, dental, vision, everything's going to come in the same envelope if they're enrolled with Anthem. So it'll be a one-stop communication, certainly with very specific items outlined in red that we want the members to focus on. So enhanced direct technology, EDE, I'm sure all of you are taking advantage of the direct enrollment that's available through Health Sherpa and Cornerstone. Again, it makes enrollments very easy coming through the system. They're seamless, they're quick. Again, we are also directing customers in the renewal packet that they can update their demographic information. Maybe their address changed, maybe their income changed. It's absolutely critical that that information gets updated. They certainly can be proactive and do that at myanthemchoices.com, which also will give them their 2025 plan rate, update any personal information that needs updated, as well as let them know what other options are available for them without necessarily needing to log into healthcare.gov to do that. Grandmothered and grandfathered renewal letters are going to be going out early next week. So those are going out separately from ACA renewals, but absolutely we're renewing our grandmothered and grandfathered block again for 2025.
Nancy, can I jump in here real quick?
Sure.
Will agents be able to see these grandfather renewals out on Toolbox?
Yes.
Okay.
Yep. By the end
And
of the month, they will.
okay. Okay.
So as a
Great.
reminder, on individual, you don't actually get a renewal letter per se like you do on the group side. When you log into the toolbox and you look for Nancy Kuzenko's grandmothered policy, it's going to show you what plan I'm on, it's going to show you my current rate, and it's going to show you my renewal rate. But I don't believe they actually download the renewal letters themselves per se. And then, of course, recapping the 2025 renewal information. Again, we thought it was really important to point out to members it's key, absolutely, to update their income information. We found out even with our health plan advisors, which are the HPAs that are there to help you. Certainly, we know everybody's got their hands full this time of year with Medicare, individual, group. So the HPAs are there to help you and your members move through the renewal process. So myanthemchoices.com is the website that members can do that. We're also adding some new heart healthy plans, which Kathy will be going over. So again, we really think this is a great feature, and we're really pleased to be offering some of these options in 2025. And again, we want to point out again, if the member made a decision for 2024 because it was the lowest cost silver plan, we definitely want to bring to their attention that that plan may no longer be the lowest cost plan moving into 2025. Again, some tips. Again, the renewal information will also include information on our Community Connected Care program, which is a social program that helps members get access to things like housing, utilities, maybe food or transportation. Again, you can help them determine their eligibility for these types of social programs by completing a self-assessment with the Sydney app or through that My Healthcare check-in tool. Again, the QR code for myanthemchoices.com has also been added to the tips page for a very quick link for the members to get access. That's included in their renewal letter. We're also including information on GeoBlue on that tips page because we know under 65 as well as over 65 members are definitely traveling more, especially outside of the country. And we're adding that quick link, $0 drug list link to the know the cost of your medications. So again, trying to keep it very informative and very simple for our members. The AOR process, want to take a couple of minutes just to recap that. Of course, any on exchange AORs absolutely are processed exclusively through the FFM or healthcare.gov. Any off exchange ACA policies or grandmothered or grandfathered policies, those requests to change brokers have to be on our AOR form. It's the same form that we've been using in the last couple of years. We do not accept handwritten letters like we need on the Medicare side. So the agent, new agent of record, can complete the form. The member can complete the form. But bottom line is both the agent and the member need to sign the form prior to the time that it's sent into the sales compensation mailbox at producers@eleventshealth.com. Of course, we also include the fax number if it's easier for you to fax, then email that form.
And I might add, if you need that form, just let us know, let Brad or myself know, and we'll get that to you.
And with that, I will turn the presentation over to Kathy.
Hey, thanks, Nancy. So let's talk about our individual and family plans for 2025 and any changes that we have made to these plans. So our big three this year, individual and family plans may qualify for as little as a $0 premium. Our plan benefits include $0 preventive care, $0 virtual care, and prescription drug coverage, including $0 for some commonly used medications. Mental health services are available in person, virtually using our Sydney Health app. And of course, we have programs to help members with additional savings, including smart rewards and special offers, which we will touch on as well. So with our Anthem programs, we include virtual care and preventive care at no extra cost on our PPO plans. The prescription drug coverage offers convenient home delivery, and our award-winning Sydney Health app is there for access 24/7 to health plan information, including find care tools to search for doctors and hospitals. There's symptom checker, and they can even do virtual visits through the Sydney Health app. We have dental and vision coverage options, either integrated with some of our dental plans that we offer or on a standalone option. Mental health services, again, are available in person or virtually using the Sydney Health app. Smart Rewards will allow a member to earn a digital gift card when completing a health and wellness checkup. And we have special offers for exclusive discounts on health-related products and services. We have one change this year for the federal legislative updates, and that change is that the telehealth safe harbor is ending. This was something that was put into place that allowed for virtual visits under an HSA plan at no cost share. It did not have to go towards the deductible, and that's what is in place right now for our HSA plans. But that is going to be ending January 1st of 2025. So in 2025, anyone on an HSA plan, their virtual doctor visits will now have to go towards deductible. It will no longer be no cost share. This is an outline of the changes for 2025 with the IRS guidelines. One piece to point out, note of interest, is that the non-embedded max out of pocket for family has actually gone down. In 2024, that amount was $9,450, and this year it's gone down to $9,200. And you're going to see that reflected in a couple of our plans. We have added a couple of heart healthy plans to our portfolio this year. And what we've done is we've added the Heart Healthy program to 2 of our existing plans. So these plans offer unlimited access to well-being coach. They are designed to help members make healthier habits and to make changes to keep their health in good shape. It includes support for losing weight, eating well, quitting tobacco, exercising, lowering stress, and sleeping better. A couple of pieces of how the plan design works is that cardiologist visits are offered at the same copay as a primary care, as well as nutritional counseling is at the office visit copay, the same as a primary care. And there are some heart tests that are going to be covered at no cost share as well. And the Heart Healthy plans are indicated in the name of the plan designs to help you differentiate which ones include this new update. So some of the product updates we have, not a lot of changes for 2025, but one of the things that we notice is that the cost share reduction plans for the silver plans on exchange were very confusing because the name of the plan design kept the deductible that was on the parent plan. So even though a member might have qualified for a lower deductible, their plan name would still say the $5,900 deductible, even though they were experiencing a lower deductible. And we saw that that was really causing a lot of confusion. So we changed the names of the plans. So if they are on a cost share reduction plan, the name of their plan is going to match whatever deductible they have qualified for. With Wellbeing Solutions, we continue the incentive that we have currently, but we're increasing the amount to a $50 digital gift card. And the members can receive this when they visit their doctor for an annual in-person wellness exam within the first 180 days of their plan start. So this is not something that is calendar year based. It's within the first 180 days of their plan. The package names where we just discussed, we've added some heart healthy plans, and this we offer the individual foundational programs with all of our plans, and we will continue doing that. It's just listed differently with those with the heart healthy. It will say individual foundational with WBC. Engagement 50, which is talking about the wellness solution incentive, and all of the plans that aren't heart healthy are listed as individual foundational plus the Ohio Engagement 50. This is kind of a snapshot of what we are offering in 2025. Our network is the Pathway or Pathway AX HMO. We are offering 12 total plans this year. We are offering 3 bronze, and one of those is heart healthy, 3 silver with 1 heart healthy, with 2 additional silver plans that are offered off exchange only because we are limited to the amount of plans that we can offer on exchange. So we've added 2 additional silver plans that are going to be offered off exchange only. We have our 1 catastrophic plan as well that we are offering. And then our standard plans, we have 1 bronze, 1 silver, and 1 gold. The features that you will see in all of these plans is the RX Choice tiered feature for the pharmacy network. This is on our regular plans because the standard plans use a base network. That is our full pharmacy network. So if you are selecting a standard plan, the one difference you're going to see is what pharmacy network they have. If it's one of the standard plans, it will be the base network. All others are the RX tiered choice network. All of our plans use the select formulary with optional home delivery, which we'll talk about a little bit more. And as we just talked about, the engagement foundational programs, which I'll show you a little bit more in-depth information on that as well. So this is a snapshot of our 2025 bronze plans. This includes the first plan listed is our Heart Healthy plan, has a deductible of $6,000 and 30% coinsurance. And these plans also show in the name that they offer $0 virtual primary care visits and $0 select drugs. The second plan listed is our HSA plan, and this is a 7450 100% plan. And then we have our bronze 9200 100% plan. And it is also offered with the embedded dental and vision. This is the adult dental and vision that is added to it. So this is the plan that you can sell with or without the embedded dental and vision. Of course, we still have our standalone dental and vision plans, so people can select a different level of benefits if they wish, but this plan has it embedded with or without the dental and vision. And then the last plan is our standard plan. It is the $7,500 50% coinsurance plan. Our silver plans start with a $4,000 30%, and this one again is available with or without adult dental and vision. It can be sold either way. And then we have our HSA plan, which is $5,400 100%. The Heart Healthy plan for silver is our $6,000 25% coinsurance plan. Next, we have two off exchange only plans. So these two silver plans are available off exchange only. One is a $6,100 deductible with 100% coinsurance. And then the other is the $4,250 deductible and 80% coinsurance. The last plan listed is our Silver Pathway Standard Plan, which has the $5,000 deductible, 40% coinsurance. We also have our Gold Plan listed here. This is the standard plan at $1,500 deductible, 25% coinsurance, and the catastrophic plan, which is $9,200 deductible and out of pocket and 100% coinsurance. This is a listing of our foundational programs, and this is offered on all of our individual programs, on all of our plans. This includes a lot of the behind the scenes programs that you don't see every day, but these are the case management type programs to help members that have specific conditions. For example, transplant, we have behavioral health, autism spectrum, we have cancer care programs, a lot of things that are behind the scenes that are there to help members with specific medical conditions. And of course, the incentive for doing the wellness exam within the first 180 days, the member can earn that $50 gift card, and that can all be managed and seen on their Sydney app. We continue to use our select drug list. There's no change to this. This is our ACA compliant drug list that offers a closed formulary, and it focuses on the lowest cost of care options. There's drugs included for every therapeutic class and category, making sure there's no gaps in care. And it includes lower cost generic options for the more expensive brand name medications. But of course, if a member's doctor determines that the options on the formulary are not appropriate for the treatment of their member, the doctor can request an exception review for that member. We continue also to offer our opt-out home delivery. There's no change to this. This is for medications that are taken regularly, maintenance medications. Members can choose to either receive this at the pharmacy or they can get this delivered through mail order at home. There's no penalty if they want to continue the 30-day refills at their pharmacy. They just have to let us know. So this is something that they actively have to opt out of. They can either do that on the Sydney app, on anthem.com. They can call the number on the back of their ID card. So they get 2 refills, courtesy refills up front at their pharmacy. They will be notified by mail when they have their fills at the pharmacy. If it's a maintenance medication, Anthem will send them a letter letting them know of their options. They do need to make that selection by the 3rd refill. If they go to the pharmacy and are told they do not have benefits, it's probably because they did not make that call or make that connection with Anthem in some way to say, I choose to have this filled at the pharmacy every 30 days. So they can go, excuse me, to a CVS pharmacy as well to get a 90-day supply. They can do that in the pharmacy at CVS, or they can have it select to do the home delivery. This is an outline of the benefits that are available for the adults for our one plan for the silver and one plan for the bronze that are available with the embedded dental and vision. So this is what the plan design looks like for the adults. It's covered at 100% for diagnostic and preventive, 60% basic services, and 50% for major services. And you'll notice there's no waiting periods on these plans. There is the typical annual benefit maximum of $1,000. And then with the vision plan for adults, it includes a $20 copay every calendar year for the eye exam, but the copays for the lenses, frames, contact lenses are every other calendar year. There's additional benefit details. This for the pediatric benefits, they do remain the same. The adult dental coverage includes Anthem Whole Health Coverage Connection. This is a clinical integration program that enhances preventive benefits for members that have diabetes, heart disease, pregnancy, or any other qualifying health condition. They can receive additional benefit coverages through their dental plan. Next, let's look at network updates, which we don't have any in Ohio. We continue to participate in all 88 counties. And this is just to highlight the main network hospital systems in each of our metro areas in Ohio. So this is not by any stretch of the imagination an all-inclusive list of providers, but just to give you a visual on the main hospital networks in each system and in each area. So for example, we have in Dayton, we have both Kettering and Premier. Columbus offers Ohio Health. In Cleveland, we have Metro Health, St. Vincent's, and Lake Health Beechwood. Akron continues to offer Summa Health System. In Akron-Worcester, it is Pomerane. Toledo is the Mercy Health System, Fulton County, Wood County, ProMedica, and University of Toledo. Cincinnati, we use the Christ Hospital, UC Health, and TriHealth. And in Youngstown, it is Mercy Health System and Steward Health System. And out of state, anybody that's down in the Cincinnati area and crossing over the river for their health care, King's Daughters is included in out of state. Anthem also includes health savings accounts to go along with the member's HSA plan. So when you choose an HSA plan through Anthem, everything is put together all in one. So you have the same website, the same Sydney app that will show you your health savings account alongside of your health savings plan, where you can look at your benefits, review claims, pay claims, all in the same app or website. You have one phone number for customer service, whether it be about the HSA account or with your health plan. When you choose to use Anthem for your HSA, this is going to be indicated on your application. And of course, you have to be applying for an HSA compatible high deductible health plan. But please know that if your member is applying for an HSA account, our banking partner will reach out to that member to confirm their identity as required by law before they will receive their information to set up their HSA account. Once that is done, they will receive a welcome letter and their debit card. Now I want to take a minute to talk about Anthem Enhanced Choice. As many, if not all of you know, we made the decision when the Department of Health and Human Services decided to change the rules for short-term plans, and they went from being 364 days in length to only 3 months in length. When that happened, we made the decision as a company to no longer offer short-term plans. So the last date that this plan was available to sign members up for was on August 2nd. Anyone who was enrolled in a plan by August 2nd, they will be able to continue out their plan's length of time of the 364 days. Members that are currently on short-term plans have a couple of options for making sure that they can continue care after the end of their policy, since they're no longer eligible for applying for a new short-term policy. One is to enroll in an ACA compliant plan during open enrollment for a January 1st or February 1st effective date. The other is, and this is an Anthem decision, we've decided that we are going to offer anyone that is on one of our short-term plans currently, they can enroll in an ACA compliant plan with us at the end of their short-term plan. So this has to be done within 60 days of their coverage ending. It has to be done on a paper application. So this can be sent in through the email or fax, but it cannot be done online, and this is for off exchange only. Please make sure that when you're talking to your members about this, they understand that if they wait until the end of their short-term plan and enroll on an Anthem plan, the ACA plans, they will not be eligible for any of the cost share reductions. They won't be eligible for any of that when making this change. This is just a snapshot of a couple of the letters that members will receive if they are on an AEC plan. And you will be receiving a copy of this presentation so that you can kind of enhance this and make it larger so that you can actually read what is in the letters. If this is a situation that you have members in and want to follow along with the information that they are receiving. So the first one is telling them that when their plan is going to be ending and that there is an open enrollment that they can participate in. Those letters have already gone out. The next letter is when the plan is going to terminate. So this will be at the end of their plan, and it's notifying them that they can enroll in an Anthem ACA compliant plan. Next, let's hit on our specialty products. The convenience and value of integrated benefits, of having all of your plans with one provider, with one carrier. We have the large national dental and vision networks with providers that are close to your clients, and of course our clinical integration with Whole Health Connection that offers better health and a better member experience. We offer one of the largest dental PPO networks in the nation. With our individual products, we offer the Anthem Dental Prime network, and this is a national Blue Cross and Blue Shield network across all 50 states. The larger the network, the better access your clients have for utilizing in-network providers. We see 74% is in-network utilization by our members. We have an average of a 40% member discount as well with our dental network. We are also one of the industry leaders in dental care options at home. This includes dental at home, which keeps employees covered and helps avoid high costs of emergency room visits. This is virtual consultations with board licensed dentists. This can be done on a computer, smartphone, tablet. This is a way for members to have dental visits when they're not able to actually visit a dentist in person. We also offer ortho at home, which is a convenient way to access orthodontic treatment from home. This is using clear aligners without the cost and hassle of full braces. And this is for mild to moderate teeth straightening. So it's not going to be for everyone, but it is certainly a viable option for many of our members. And then dentures at home. This offers the fit for replacement dentures only. So this would not be for their initial fit for dentures. But if they need replacement dentures, this is overseen by a licensed dentist, and there is a lifetime replacement guarantee when they use this feature. All of these benefits are available to the members on our dental plans and are covered at the same level as what they would do for in-person visits. Our Blue View Vision nationwide network is one of the largest in the nation, again, but we have a good mix of 76% independent care providers and 24% of retail network. And when I'm talking retail network, that's LensCrafters, Pearl Vision, Target Optical, but we're also talking about those online providers such as glasses.com and 1-800-CONTACTS. So there's a wide range of providers that our members are able to use in network. We also offer value-added benefits that can lead to lower costs and improved care, including polycarbonate and transition lenses for kids under age 19, covered at 100%, 40% off additional pairs of glasses, savings on a lot of the most popular lens options and upgrades, such as scratch coating. Actually, scratch coating is covered at 100%. There's discounts for laser vision correction, discounts on prescription eye drops for myopia or dry eyes. So there's a lot of additional benefits that are available to our members on our vision plans. And just another little point on GeoBlue, Nancy mentioned this earlier. This is something that we're putting into our renewal letters this year on the tips page. GeoBlue is the health solution of Anthem Blue Cross and Blue Shield for members that are traveling outside of the company. So if you have members that are outside of the country, I'm sorry, if you have members that are traveling outside of the country, it is very important that you take a look at these programs for your members. It is very easy to do, very quick to sign up. They have a mobile app that can help them through navigating if they need to find care outside of the United States. If you want more information on this, you can reach out to our partners at Cornerstone, or there's also a link that is listed in the presentation that you can click on so that you can learn more information about signing up. Next, we'll just hit on commissions. There are no changes to this, but just as a reminder, with our ACA programs, commissions when you're working through a general agent will continue to be $18 per member per month with a maximum of 2 members per policy. Grandmothered and grandfathered programs, there is no change to those as well. That is the end of our presentation, right at 10:29. I do want to point out that we will have a couple of additional, some additional slides in the deck that you will see, and this will cover accessing K-Health and Live Health Online virtual care visits on the Sydney app, pharmacy information, how to access that, as well as some additional resources that are available to you.
That's terrific. Thank you, Kathy and Nancy. That was probably one of the most thorough and metered presentations we've had so far since September. So we greatly appreciate your diligence. There are a few questions, so I hope everyone can stay on just so we can get those answered. Jeff, do you want to field those questions? Hello, Jeff. All right, I'll just ask the first one and Jeff can jump in when he does. So Rod asked, does Christ Hospital in Cincinnati, Kathy, it's probably better for you, also include the Jewish hospital? So the
Jewish is
Christ Hospital.
not, yeah, Jewish is not part of the network.
Okay, no Jewish hospital. So only those branded as Christ.
Correct.
Okay, great. I think you alluded to this, but are you going to be able to send us maybe not the full slide deck in PDF, but some of the key slides maybe we can discuss, or you already have those out to the brokers for the webinar?
We'll be
Didn't know
sharing
if you
that
were.
with you so that you can distribute
Okay.
to,
Okay,
yeah,
great.
anyone who
Thank
is
you.
on
So,
the, yep.
yep, the slide deck or maybe a more focused slide deck will be sent out to you all probably within the next couple of days when we send the recorded follow-up notice in a day, probably usually takes. What else is here? Is there a requirement for enrolling in the HSA plan? I have to believe he's talking about um, the affiliated bank that the HSA savings go into.
Mhm.
Um, so is there that requirement that they show that one is set up?
No, it is completely up to the person if they want the banking piece. But if they want to do the banking piece, they do have to be enrolling on an HSA plan.
Yeah, HSA specific, not just one called a high deductible health plan. So
Correct.
HSA specific. What is the impact to a member of the different pharmacy networks? I
So
think,
on the standard plans, they offer the base network, which is a larger network of pharmacies. With the RX Choice, there are tiers. So depending on which pharmacy they are utilizing, tier 1 or tier 2, they could be paying more out of pocket.
Hey, Kathy, it's Jeff.
Yes. Yeah.
Can you remind us how we can look up the pharmacy network?
Yes, it is actually, let me flip to the slides here.
Probably in that appendix, I'm guessing.
Mhm. Bear with me while I go through all the screenshots for
And I'm guessing you're going to probably include the appendix with what you send to us, because there's a lot of
correct.
great, useful info. Terrific.
Yep. There we are. Okay. So this is an actual link that you'll be able to use to go directly to the drug list,
Mhm.
and then you would make the appropriate selection here. And
Okay.
then for the pharmacy, you would go to the RX
Gotcha.
pharmacy or RX network search, and this is a link as well.
Fantastic.
And
Very easy.
that's
Very
really
easy.
great to make sure that they're staying in that base level
Or you can just
network.
hit the find care. I love that find care button
Yeah.
because
Yes.
that's everywhere. So
Yes.
I love it. I love it.
Good.
And with
Great.
Find Care, you can always search as a guest. So when you're looking at, for potential members or you want to look something up yourself, it's not necessary to have a member ID to log in.
Okay. And I see one last question. So everybody else that's remained on the call, if this is your last chance to get some questions in if you have them. But one of the last questions I see that Uday is asking, for enrollment in the Heart Healthy Plan, is it okay to ask the client's health condition? And I would say that when they give you their drug list, um, it's probably kind of showing up, giving you a guess that they have some heart condition if they're on about 3 or 4 hypertensive medications. Um, but it usually comes up. You don't have to ask, as you all know, like I do, when you're sitting with somebody, they probably tell you more than you want to know. But I don't think it's a problem to ask them if they, based on seeing the drugs that they have, to see if there's really, something cardiac related in their health.
And
Right,
the heart
ladies?
healthy
Right.
plans are not exclusive to people that only have heart conditions.
Right.
Someone can enroll in that plan who doesn't, and maybe there's a family history that they would like to get with the health coach on so they don't have heart conditions moving
There you
forward
go.
or
That's a
heart issues.
great answer. That's a great answer. Good. I'm not seeing, let's see.
Jennifer has a question.
Yeah, I see that. Is Dayton Children's in network?
Double check
Mm.
on that.
You know what? I was just making my 25 list, which we're going to share with you all, like kind of consolidated. Let me see. Dayton Children's. I do see it in the Anthem network based on 2024.
I don't know of any changes there, but I would want to double check that before I answer.
Yeah. Okay. Yeah. Yeah. And I'm just only quoting 2024. 2025 is all, could be different.
Brad, I'll get with you after this presentation because I'm not able to access anything
Okay.
while I'm sharing. So,
Okay. Okay. Jeff, please remember to follow up with Jennifer on that one.
Absolutely.
Got
Absolutely.
it.
Will do.
I know they are for 2024 based on my exacting list where I went through every carrier's member portal and did searches. So if you don't have that, just ask me or Jeff for it, and we'll send you the 2024 version. We tried to circulate it, but I I'm just about ready to send a regionalized version of that here, probably right around November 1st, once we can see all the carriers provider networks for 2025. Speaking of which, Nancy, Is your 2025 network list already out there and available?
It should be in Broker Hub, yes.
Okay, great. All right, I think so. Jennifer, we're gonna follow up on that. So, in respect of everybody's time, Jeff and I want to thank Nancy and Kathy for being great partners, and for doing this for us. I know that you've probably already done it several times for the larger audience, but we really appreciate you making us being special. There's another question. Jennifer saying she is having a 2024 claim denied due to the Dayton Children's Hospital being considered out of network. So not sure about that. So
Yeah, let me
yeah,
phone you,
Jennifer, we will.
Jennifer.
Yeah,
I'll follow up
yeah.
with you, Jennifer.
Actually, Jennifer sent that to me yesterday, and
Oh,
I forwarded it to the service reps.
Oh, great.
okay, okay.
Fantastic.
So that,
Good. So being worked on.
Jennifer, I'm sorry if I didn't copy you on that I sent it on, but they will be working with you on that.
That's great. I appreciate that. Thank you, Jennifer. I'm gonna put a giant question mark on my sheet for 2025 there. So I just did that. So thank you for that. Appreciate it. Great. All right, everybody. Happy selling. I know you're in the midst of Medicare, and soon you will be in the midst of Medicare and the marketplace. So good luck to all. We have just a couple of more weekly trainings. I think for maybe like the next 2 weeks, I think our ACA carriers or FFM marketplace carriers. Anthem was the last one. So I think we just have something like just a couple of extras for you, something in the ancillary network. So if you can join those are probably already sent out or available via the Monday Minute or the Resource Center on crnstone.com. So thanks, everyone. Really appreciate you being here and spending the time with us. So, gonna say goodbye now. Thank
Everybody have
you.
a
Have a
great
great
day.
rest of the week. You got it. You too. Thanks. Bye, everyone.